So what happens if your dog needs therapy and rehabilitation? I personally have one who's a senior and he's needed some, and so I turned to my favorite veterinarian, Dr. Leonda Armstrong. Great to have you on.
Thank you, Sandy. It's so great to be here.
Well, you own Circle L.
I do.
Animal Hospital in Chino Valley now, and also Four Paws Rehabilitation and Wellness, and as if that weren't enough, my friend, you also have the Hacienda Canine Resort and Spa.
That's correct.
These dogs live great, but it's because you care. Now you're certified in doing things like acupuncture and massage and laser, and that's in addition to being a veterinarian.
That's correct. I also have a certification in canine rehabilitation therapy. So I am a veterinarian, a rehabilitation therapist, as well as an acupuncturist, and am currently working towards my chiropractic certification, as well as my Chinese herbal certifications as well.
I tell you, it's great. There's so many different things, and I know that so many of those therapies have really helped my senior dog. And sometimes it's the seniors who really have these problems. What classifies as a senior dog?
So basically, it's any dog over the age of 7.
Okay.
Because they typically age, depending on the size of the dog, anywhere from 8 years to 7 years based on our age. So if we age 1 year, they age 8 or 7 years, depending on their size.
Oh my goodness. Well, we have Tawny here, and I mean, she is just being so good. And so some of the things you've brought, Dr. Armstrong, are things that you do in terms of therapy and rehabilitation?
That's correct.
Okay.
Yeah. So kind of the focus today, I want to really talk about our seniors the most importantly. Rehab can be for any age pet. So obviously Tawny's a young dog. She's my agility dog, and we do a lot of sporting events with her. So I work a lot with sporting dogs as well, but for our segment, seniors are really kind of the key to things. And so when we're talking about an older dog, there's lots of different things that create pain for them. And one of the most prevalent is arthritis, and that's the one that we hear about the most. That's the one that we're the most concerned about most of the time. So where rehabilitation fits into that process is to allow us to be able to help with their pain, to keep them strong so they don't lose muscle mass and tone during that time when they can't use their legs as well as they should. So part of what I do for my senior pets is we do herbal remedies and things like that, so natural pain alternatives as well as joint supplements. Then we also set up home programs for clients so they can actually do these home exercises. So I'll show you a few exercises with Tawny, and then I'll show you a couple of pictures of one of my patients after that.
And oh, interesting.
Yeah.
Okay, the before and afters almost.
Kind of.
Okay, let's see what Tawny can do.
Tawny, are you ready? Well, come then. Okay, so this is ramp work. And so oftentimes, up, we'll put our senior dogs up on the ramp with their feet on the table. What this does is help to strengthen their back end. So then we can actually push them from side to side. And as you kind of watch her muscles, you'll see her contract to hold herself steady.
Oh, okay.
So that helps to strengthen these back muscles as well as her spine and her hips. So we'll vary the angle of the ramp and the height of the table based on their ability to be able to do the exercise. Some dogs can only do a very narrow step. Come, come. Paws up only. Wait. Come, come. Off, please. I know that's close. Here. Ready? Up, up. That's it. Wait. So this is just called a box stand. So it's much lower. You don't see as much angulation. It's a little different exercise. It's actually easier than the ramp because they're not changing their spine as much. So, girl, yay!
It's too fun to sit on.
So this is an agility course. And then we'll have them step over. Tawny, over, please. Good. And up and over. Yes. So we'll do different things like that.
So it's Pilates for dogs.
It is. It is. It's a lot of different yoga exercises, Pilates, all kinds of fun things.
But it works for a dog as well as it does for a human being then, obviously.
And then the fit bone's a totally different thing because it's an uneven surface. So you can see it rocks. So if I need to work front end, I can work front end. So every time I bounce that, she has to balance herself and those muscles contract. We can have the whole body up there. Stand.
She likes that. It's sort of a dog bed.
It is.
For her. I noticed she was enjoying it.
Now, of course, I'd never do this with a senior dog just starting off.
They wouldn't have the stability, probably.
That's correct, but it's an advanced exercise.
Okay.
So we tailor each one of these exercises based on the animal's ability to be able to do whatever they can do. So when you're looking at a senior dog, it's super important. They come in, they have a good, thorough orthopedic exam. We may need some x-rays to see what's going on with them, whether it's their spine, their hips, or their back. Then we develop a home program, and most of these things you can make at home. It's very easy, it's not expensive. And then you can develop that home program at home for you to be able to do these exercises with your dog.
To strengthen them.
To strengthen,
You have
to
some
help them
x-rays
balance.
of a senior dog. So
I do.
let's check out one of these x-rays, and you can show us the problems and the fix for that, how that worked.
Absolutely. So what you're seeing right now is just a normal elbow x-ray. And then we'll be showing some hips as well. And so this x-ray is actually of bad hips. So on one side you have a really normal hip, and then on the opposite side you have a hip that has tremendous arthritic changes already.
Oh, you can really see that.
It's not sitting in the socket the way it should be.
Right.
Yeah. This is actually an abnormal knee. So this is really significant degenerative disease in a knee. And so it depends on the joint. We can have arthritis in every joint in the body. We'll then see some spine x-rays. This spine is fairly normal. There's not a lot of changes. So this is kind of a normal film, and then we'll see one that's a bit more abnormal, where you can actually see, if you look down towards the very back where the hips are, you see some ugly growth of bone coming across the spine. That's called spondylosis, and what that does is that's the body's way to stabilize the back from abnormal movement. So that's spine arthritis and degenerative disease there.
Wow. And so you can work with all those, and what kind of changes do you see after, or do you see changes after the exercise, or is it just strengthening, or?
So we're never going to change the bones. The bones are the bones. It's the body's way to heal abnormal movement. So when the body lays down additional bone, it's because there's weird movement in a joint. So by providing that stability, the body thinks it's stabilizing that area so it doesn't move abnormally anymore.
Oh.
Sometimes that's a good thing, and sometimes that's a bad thing. So what we do is we work very closely on the weakness of the patient. So if the patient is really weak, we want to strengthen certain muscles. So we'll target different muscle groups. We may do core exercises, we may do back exercises, we may do front exercises. It really depends on where the patient's injuries are the most.
Phenomenal.
So that we
And
can
you're
figure out what to
talking
do.
like rehab after surgery and everything too.
Yeah,
but with the
absolutely.
seniors, you know, this gives them, because a lot of times they're still healthy, everything's going great for them.
Absolutely.
But if they can't walk, it doesn't make any difference. So
No.
they've got to have this strengthening.
It completely affects their quality of life. And that's where Joey comes in.
And this is not something that's been like really readily available at all in our area, really. And now we can have this done. So
Yeah.
absolutely fascinating. I love it. I'm a fan.
Thank you.
It actually works. I've seen such difference with my senior dog personally.
Yeah.
And so I recommend it. And Tanya, you did really good. Really well, didn't you, Loco? Well, Dr. Leonda Armstrong, thanks so much for joining us.
Thank you very
much. And again,
much.
what a fabulous addition for pause rehabilitation therapy, and makes a difference.
Great.